if I were to tell you, 2 years ago I had a heart attack, I wouldn't be that embarrassed about it. But I might be more reluctant to say, oh, by the way, I've had epilepsy all my life. People are not that forthcoming. They find that there is a stigma, that it's an embarrassing thing to admit. And about a quarter of adults who have epilepsy say that they feel this, that they're discriminated against in some way because of their seizures. And obviously, that feeling is not going to help, right? So anxiety, depression, social isolation, these are issues for people with epilepsy. And we're going to get more to that, depending on how fast I talk, if we get to the comorbidities part. Okay, so this is the easy part. This is a review for the test. Epilepsy affects about 0.5%, so 1 in 200 of all comers. There are many etiologies. It's expensive. About a third of the people continue to have seizures no matter what you do, even if you give them the best care. It's associated with increased mortality. We haven't talked about that yet. Decreased quality of life, that's kind of obvious. And the treatment goal, obviously, is to stop the seizures, but also not to have side effects from the treatment. So what is the usual treatment for epilepsy at the hospital across the street? Has anyone been to the hospital across the street? No one. No one? Okay. What is the usual treatment for epilepsy? Anybody? Or what treatment did you see?
Jessica Sanchez, celebrity singer.
Sorry?
So anti-epileptic drugs? Is that one of the answers? Yeah. Okay. So
Bamboo.
there are now more than a dozen anti-epileptic drugs that you can choose from. And some of them you choose for certain types of seizures. And they usually work.
Red pepper chili, that's very
But one of the issues with anti-epileptic drugs is side effects. And each drug has its own long list, of course. But a big one is sedation, dizziness, headache, nausea, those kinds of things. So sometimes it's a struggle to come up with the appropriate dose without getting side effects that the patient doesn't like.
Canadian guy.
Bruno Mars.
Oh, Bruno Mars. There you go. That's a good one.
So we'll talk for a few minutes about the ones who are hard to treat. About a third, 35% of the patients have uncontrolled seizures despite treatment. They may have side effects from their drugs, decreased memory, depression, and injuries. Injuries are common. One of the things I do is consult with a company that takes care of thousands of patients with epilepsy all over the US. And I got an email the other day that this young boy had fallen out of bed and dislocated his shoulder. And this is something that happens with epilepsy because of the muscle contraction during a seizure, that recurrent shoulder dislocations can occur. And also, obviously, fractures because the patients fall. So if a patient with epilepsy cannot control their seizures, this is what happens. Twice the number of fractures and head injuries, obviously status epilepticus times 10, motor vehicle accidents, more drugs, hospitalizations, ER visits, outpatient visits, and of course, more neurology visits. I used to have an epilepsy clinic where all day, all I would do is see the patients who continue to have their seizures, and we would say, okay, you've been having seizures for 3 months. What can we do that's different? The patient that I saw in Tagum, Davao the other day, we talked about her seizures, and she said she used to have convulsions where she would be incontinent and bite her tongue as part of the seizure with no warning. And her husband would describe what sounded like a convulsion. She was started on Tegretol, carbamazepine, which is a commonly used drug. Do you use that here? Carbamazepine? Does that ring a bell? Yes, okay. So 1 in 50,000 with carbamazepine can have very serious leukopenia, so you're supposed to check CBC from time to time. But she was started on 200 milligrams of carbamazepine a day, and what she said was that she was now having a seizure about every 2 months or every 3 months, which was better than before, and she was no longer biting her tongue, and she was no longer incontinent, but she would still have these episodes of becoming unconscious that were unforeseeable, would happen suddenly, and she would fall. But her dose was 200 milligrams a day. So if you look it up in the book, you'll see that that's a very low dose. So she's the one I said, you know, I think you should double your dose, 200 twice a day. The half-life of Tegretol also is only about 6 to 8 hours. So if she's only taking 200 milligrams once a day, they're pharmacy students here, right? Yes? Okay. So if you're only taking 200 milligrams once a day and the half-life is 8 hours, by the end of that day, that Tegretol level is going to be very low. So a twice-a-day regimen would be better. And ideally, you would do a serum measurement to find out what that level really is. You can measure the carbamazepine level in the blood, and you want to know what it is. But that's probably not going to happen in her case. But that's what I would do in a normal clinic setting, to get the level higher, so at least it's within what they call the therapeutic or the reference range. But the target is really seizure control, regardless of what the number is.